My name is Rachel and I work at the Brookfield Library, and I would like to welcome all of you to our program this evening. We'll be speaking with Maureen Farrell and Dr. Ken Pellegrino about the COVID-19 vaccines in Brookfield. I want to thank everyone who sent in a question. I believe that almost every question submitted has been incorporated into our talk this evening. Before we get started with our questions, I'd like to ask our guests to introduce themselves and tell us what their role is in the vaccine rollout in Brookfield. Maureen, would you go first?
Sure. Hello, everyone, and Rachel, thanks so much for having us back. You're a great moderator, and I really appreciate the fact that you gather a lot of questions from the community that we can help answer. So my name is Maureen Farrell, and I am the COVID-19 disease coordinator for the Brookfield Health Department. I'm working on two special projects. One of them is contact tracing, and the other project is rolling out the vaccine program here in the town of Brookfield. I have a background in public health. I'm also a registered dietitian and have spent a lot of time working on different initiatives in the community around chronic disease prevention.
Okay.
Ken.
Hi, Ken Pellegrino, family physician and board certified in family medicine and still a licensed physician, though 11 months ago I did retire from active practice. I am a volunteer on Maureen's team, helping supervise clinics for her as well as vaccinating patients. And I've practiced 35 years here in Brookfield in family medicine. And some of you may remember I actually started the practice 35 years ago. So.
Wonderful. Well, thank you both so much for agreeing to be here. So ordinarily I would want to start our talk with some basic information on the science behind the vaccines and talk about safety and efficacy. But I think that most of the people watching really want to know what's going on right now in Brookfield and in Connecticut more broadly. So after we cover that, I think we will also talk about those more fundamental issues, science, efficacy, safety of the vaccines. So I really hope that people will stick around for the whole conversation. And we promise we will do our very best to keep it shorter this time. So first, let's start out with an update on Brookfield. So how many people over 75 who signed up have received their first vaccine, and how many have received their second?
Okay, well, I'm going to take that question because I've been working very closely with Ellen Melville at the Brookfield Senior Center and her staff to do outreach to the senior community here in Brookfield. And I can say that probably between 80 to 85% of our 75-year-olds and older have received their first vaccine. And actually Thursday would have been our first wave of older adults, the 75 and older, getting their second dose vaccine in our Brookfield clinic. That clinic has been moved to tomorrow because of the snowstorm. So we're beginning to start the second doses of the vaccines for our 75 and older. We are still doing, and I want to thank those of you in the community who have actually lent a helping hand as a good neighbor or family member to those 75-year-old and older adults, as we do know that there were some technological challenges with using the VAMS program. And so we sent out that message, phone a friend. And that message is still out there. We're still encouraging people to do outreach to older adults in the community because we want to make sure we don't miss anyone. We know we have some homebound seniors. And for those homebound seniors, I have volunteers making phone calls. We're calling the Meals on Wheels list, people who live in Brooks Quarry or residential communities where we know there's a lot of older adults. So we're calling lists of people to see who has gotten a vaccine, who still needs a vaccine. And again, I'm going to make a call to action for people in the community that this is a community initiative. It's really all of us working on this together to get everybody vaccinated. So if you know of an older senior who's homebound or may not have gotten the vaccine because they had trouble with their computer, or they don't have a computer, or it's not up to date, lend them a helping hand and help them, get their vaccine appointment. But we're doing pretty good. I think that the seniors have been surprisingly happy about how the vaccine program has been rolled out here at the Brookfield Senior Center.
Wonderful. What about the first responders in town? Have they all received their second doses at this point, or is that still an ongoing process?
Well, I think the majority of our healthcare professionals and first responders have gotten their first, and most of them have gotten their second doses. I think that those, because that first 1A wave started back in mid-December. So many of them by mid-January and into now probably have gotten their second dose.
Okay, great. And
I think I saw a number. There's like 1,500 in Brookfield. I'm trying to remember a number I saw, but I think it's like 1,500 as far as in that 1A group that have gotten vaccinated.
Okay. And can people over 65 make their appointments now? Do you know if, I know they can sign up, but are they able to actually get through VAMS and make appointments at this point? And have you administered any vaccines for 65 and up yet?
All right, so I'm gonna, if you don't mind, I'd like to just share my screen a little bit about the eligibility in Connecticut.
Sure.
So which screen? This one. I think it's really important to show the eligibility guidelines here in Connecticut. As you can see on the very far left, the 1A is our healthcare personnel, first responders, people in our long-term care facility, which actually Connecticut is leading the country in getting their residents in long-term care facilities vaccinated. So we've done a really good job. 1A is pretty much wrapping up, and we're in 1B working with our 75 and older who are now starting to get their second doses. And those individuals who are 65 and over, they can schedule now. I will tell you though, if you get an appointment that's early or mid-March, that's actually a really good appointment date because, remember, we had to schedule all the 75-year-olds first. And so many of them are just, finishing up their first round of doses. And then when you go on to VAMS, I'm going to make a recommendation that people check frequently for those appointments, because as vaccine clinics in the greater Danbury area receive notices about the amount of vaccine they're going to receive, then they'll post more clinic availability, more appointment availability. We've been asked not to overpromise appointments, and we don't. So we've been asked to not to try to schedule too many people and then have to cancel them. So it's sort of a balancing act that we have to have with how much vaccine are we going to get and how many appointments can we actually open up. But individuals who are 65 and over can now schedule an appointment. I think it's important to point out that there's more information coming soon, early March. They do what the DPH is saying right now is that frontline essential workers and individuals with high risk health conditions may receive eligibility sometime in early March. Do you see this rationale here on the right-hand side?
Yes.
The reason why they rolled out 75 and older first was that even though they might only be 8% of the population in Connecticut, they're 71% of the deaths. And individuals who are 65 and over are maybe only 18% of the population, but they represent 88% of the deaths in Connecticut. So that's why Connecticut has been very focused on first doing the 75 and older, then the 65 and older, then moving to more eligibility groups.
Okay, great.
So Maureen, do you want me to just say a word or two about who might be high risk? Because sure. I looked at that site today on the portal.ct.gov. It's a great site, portal.ct.gov. They will actually go over these guidelines on individuals with a high risk condition. And they differentiate people who might be at increased risk, who are at increased risk, and people who might be. So the category and people who are definitely at increased risk are smokers, people who are immunocompromised, people who have cancer, COPD, definite heart disease, significant obesity, and type 2 diabetes. Those people collectively are at increased risk, and they'll be in the next group of 1B coming up very early in March. There's another group who may be at increased risk, and these are people, for example, who are just overweight, people who have high blood pressure, people who have other milder medical conditions, and they actually give a list of what those conditions are. So those people probably will not be in this next group because they really are not at high risk, but it's rather those people with those other diagnoses who will be and should be vaccinated next in the next phase of 1B.
If I could just give you a little bit of an idea though, what does that mean as far as population in Connecticut? Or not even Connecticut, I'm going to speak specifically to Brookfield. Okay, so our 65 and older population, our total town population in Brookfield is about 17,893 adults. Of those, 3,200 are over the age of 65. The 18 to 64 population in Brookfield is actually a number of 11,235 residents. That's a very big number for a town of 17,000 people. Majority of them are between the ages of 18 and 64. And then about 3,600 children live in the town of Brookfield. I was, for the last decade of my work at the regional YMCA, I worked on chronic disease prevention initiatives, including diabetes prevention and blood pressure self-monitoring. And these programs are still going on at the Y. But I learned a lot about our population health as a result of my work. I had to know that for that work. And so I wanted to share that obesity in our area, about, in that 18 to 64 category, or actually age 18 adults, about 35 to 40% of adults are overweight or obese. 10% of adults have type 2 diabetes. And this is just in Brookfield. And then hypertension exists for about 27% of adults in Brookfield. And smoking, I was really shocked at this, about 12% of people are smoking here in Brookfield. So these are some important numbers. And when we're talking about 11,235 people, about more than half probably have some type of underlying chronic condition.
So this is something that I wanted to address, and that is how will people with underlying conditions sign up? And then, so through the state health department or something like that, I'd like to talk about that a little. And then I'd also like to cover, just the more general question of how are they going to manage, how are people going to prove an underlying condition? Do they have to verify claims of it? There's a lot of issues that would seem to complicate the question of underlying medical conditions. So I know you don't have all the answers to it, but I just want to just have it out there and just sort of just address it a little bit. So
I'd like to, and thank you for asking that question. I do think it is an important question because it's something I've really worried about because honestly, in our town hall at Brookfield, we don't have the medical expertise or the medical professionals that can determine, who's eligible for what for 11,000 people, right? There's 11,000 people. And how can, are we going to call the first selectman's secretary and start telling the secretary all of your health issues, or the administrator at the health department, or, Paul Avery, our town sanitarian, or, I really worried about that. I'm like, there's no way that we have the qualifications to be talking to people about their medical conditions. And the state has determined, and I'm going to share another slide. They have determined, the eligibility group. And so in thinking about that, I felt it was really important that people go through the state process to become, to get their VAMS invitations, because they're the ones who are setting these eligibility guidelines. And so they should be able to determine how these invitations are going to go out to make appointments for vaccines. And because quite frankly, I think it's more important at the health department that we spend our time building our capacity to deliver the vaccines. right? That's really what you all want. If everybody wants a vaccine, we have to work on building our ability to deliver more vaccine when those vaccines become available. And that's where we should be spending our energy, not trying to determine who should be getting the vaccine. So I'm going to share one more screen here. Hopefully I'll be able to find it. Where is it now? Well, I'm going to share this. I'll go here. And so this is what we put on our town website really just yesterday. And some people may have actually received an email from the town letting them know to prepare for this. So this online VMS enrollment at ct.gov. This is the Connecticut DPH form. So Connecticut Department of Public Health form that you can complete when Governor Lamont announces that your group is eligible. It won't allow you to sign up for a VAMS appointment before your group is eligible. I'm going to actually click on it. Let me see if I can. And this is what comes up, online VAMS enrollment. And you will put in your first name, your last name. Very, very important that you put in your unique email. Every single person who registers has to have a unique email. Very important. You'll see your zip code, date of birth, and then it does this drop down.
Oh, you know what, Maureen, it's not showing.
Many of you have probably realized today that, oh, my chronic disease is not in this drop down.
Oh, Maureen, I'm sorry to interrupt, but it's not sharing that screen.
Oh,
so I would very much like to see that. Yeah, stop and restart it. That's the easiest way to. Sorry to interrupt.
Let me see if here it is. Thank you for letting me know that.
Of course, there we go. Now we can.
Thought I was sharing it. Here's the online VAMS enrollment. You're going to do your first name, your last name, unique email. Very important. There is this drop down here, eligible occupation or age eligibility requirement, because this drop down right now is matching 1A and 1B so far, right? But if you drop down today, you won't see chronic diseases on there because that eligibility is still being decided. But what we have done is we've now given you the information that when your eligibility is announced, you go to this site and you put your name on here and they will take care of sending you your VAMS appointment invitation.
Thank you. I actually had where there was a specific question about this from someone, and I'm really glad you addressed it. And that is, not having the underlying medical condition being one of the drop downs. So, I'm glad that.
So what the DPH has been doing is they've been, as they add eligibility groups, they add to the drop down.
Okay. So this will not include that until
the eligibility is announced.
Okay,
until
great.
It's announced. Okay. And then you'll just submit it. You'll have to declare under penalty of perjury. So you have to prove it. I mean, you'll have to declare under penalty of perjury that you're telling the truth, and then you would submit that button. Okay. I think that's really important to know that this is what the state is asking people to do for eligible individuals. And by people going on and using this form, it will free up the town health department to really focus on what you need us to do most right now, and that is build our capacity to deliver the vaccines.
Now,
and that's what we're working on.
Now, Maureen, do you happen to know how the state Department of Public Health is going to handle the issues of verifying claims of underlying conditions, what they may require to show that, or is that still to be determined?
I think what the points that Ken spoke about, I think they're probably going to list those eligibility guidelines based to some of the data that they have pulled together as to who are at the highest risk.
Okay.
And I think that they may be pooling that information. I don't think it's finally determined yet. I don't think it's been completely determined. I think they're still making those decisions. I think those are hard decisions to make because it's actually a very large portion of the population here in Connecticut.
Sure, and a lot of people haven't been able to leave their house, or they're in a they're in a, they really want their vaccine to get back to normal life. So it's certainly understandable that people are
Right.
have a lot of
One of
questions.
the, I think there is a light at the end of the tunnel. I do know that a lot of the pharmacies, especially Walgreens, CVS, those are the two big ones that I've heard, that they are actually working directly with the federal government on
Yes.
contracts to receive vaccines. So,
Yep.
you know, you're not going to be just depending on your local health department or the hospital. It'll also be pharmacies that will be onboarding, I think, very soon. And so as more and more locations become available with vaccine, and you know, the vaccine allocation that the pharmacies get is going to be separate from the vaccine allocation that the state
Right.
local health departments get.
Yeah. Maureen, there's actually 4, right? So there's also Rite Aid and Costco. So CVS, Walgreens, Rite Aid, and Costco. And this just initiated about a week and a half ago. And you're exactly right. The administration in Washington is giving vaccine to the pharmacies separate from and above what the towns are getting.
Right.
And all of those appointments will be in VAMS when the time comes. Like,
Well,
you'll be
I don't
able
know
to
about,
appointment.
you know, the answer, that's not the case in other states. I don't know how Connecticut may. Yeah, actually, you can go in New York State, you can go in to like Rite Aid site directly and try to get an appointment.
I think that's how it will work. I think they'll work
Yeah.
independently of VAMS.
Right.
The pharmacies will have their own
Yes.
operational systems. We also have some healthcare systems in Connecticut that are operating separately from VAMS. I know Hartford Healthcare has a separate system from
Right.
VAMS, and Stamford Health has a separate system from VAMS, and I think Yale Health has a
Yep.
separate. So there are some separate things, but
Right.
the local health departments are going to be using VAMS as one of their mechanisms to, you know, get people
Right.
registered for vaccines.
Right. NYU Langone is having their own vaccine sites also. They just started this past
Yeah.
week. Yeah.
That's a, yeah.
There's going to be a lot of options.
You know, I'm going to jump at, someone had asked a question that I think is kind of interesting to pose at this point. And that is that he or she had registered through VAMS for an appointment and ended up being able to get the vaccine at a pharmacy. So he canceled his appointment in VAMS and has been receiving emails saying, it's time to reschedule. Would you like to reschedule? So he was sort of curious, like, is there any sort of consequence to that? Is anything, but it sounds like, is anything being tracked? Is it important somehow to have all of this data be, you know, being handled and things are being tracked or something? But it sounds like it's not, because it probably doesn't matter at all, right?
I think they are tracking some information, but I think for that gentleman who went in and canceled his appointment in VAMS, as I'm learning, because I had to deal with my first snowstorm yesterday and today, that VAMS sends out notifications even if you're waiting in the clinic area. Like they have these automatic notifications that that sometimes you just wish you can turn off, you know, but they're automatic, and there's, you know, because it's a federal system, and they are always improving the system. Like we have found every single week, there's new additions, new things that we can do with the system. But like with the snowstorm, you know, and having to reschedule a number of appointments, the behind the scenes work triggered notifications to people that we had already notified saying, you know, if your appointment was Thursday, come Saturday at that time. But they were getting notifications from VAMS, which can be confusing, you know, but we have no way of turning off the notifications. To that gentleman's question about, well, was his appointment, he canceled his appointment, so that's fine. Yeah. And it's still generating, well, do you still want to get vaccinated? So
what I read into the question was, is there like, you know, is the federal government keeping a tally of who's, you know, how many people are being vaccinated through VAMS? But they couldn't possibly be, because there are so many different ways that people are registering. So
I think they're going to want to know how many, what percent of the population gets vaccinated.
Of course,
the goal is like 85%.
Of course, but they're not using VAMS to achieve that because it's not the only system to do it. So it's not.
But Rachel, the pharmacies and the health systems still get their vaccine from the federal government. It's all from the federal government. So they're going to report back their data to the federal government. So they'll get the data and collate it all.
Sure.
So
I think this person
counted.
just was wondering, I believe this person was wondering if VAMS was the way that was being reported back, but it is not.
No, I think
Not the only
that's
way.
it's just a reminder
they
notification that's
weren't
built in.
vaccinated.
Yeah, I think it's just a reminder notification built into the system.
So they could probably just unsubscribe or something, right? Just if they already got their vaccine and they've sort of moved on, I think. So
Right.
anyway, so underlying medical condition, then I think the main takeaway that people will want is that you can't sign up for it yet. That is why there is no drop down, and that people should go to the link that's included on the Brookfield Public Health Department website that will bring them to the State Department of Public Health, and then that will be the clearinghouse for sending people to VAMS to register, essentially.
Right.
But it's not
so
ready yet.
you can do it one of two ways. You can go directly to the, I'm going to share again. You can go directly to the State of Connecticut portal. I think I'm going to share again. Maybe I'm not. Yeah. I don't know if I change this page though. So you can go directly to the portal yourself. I found it a little hard to find. So that's why I wanted to put it on our fact sheet, because, sometimes on the state websites, it's hard to find what you're looking for. And so we just did the hyperlink on our town page to make it easier to find, and can you see the fact page here again or no? Do I have to reshare?
You have to reshare.
Here's that page again. So this is the link. As soon as you hear the announcement, it just saves you from having to kind of search through. But if you wanted to do find your own way to make it, to find out where this link is on the website, just go to the Connecticut DPH portal and you can do that. I also want to point out that there's an assistant line, the Connecticut Vaccine Appointment Assistant line. That's on our fact sheet. This is if you don't want to do a computer, but you want to do a VAMS appointment and you're eligible, you can call an 877 number. It's open 7 days a week. And we've had a lot of older seniors actually have success at getting appointments this way. And then
that's great.
And then there's also a link to other ways to have vaccine access if you didn't want to go through the VAMS program. And that's a hyperlink that I have here, the COVID-19 vaccine access for those 75 and older. That will take you to another part of the Connecticut DPH portal that will list those.
Okay, great, thank you. The other piece of the next phase is the frontline essential workers. So I just wanted I wanted to give you the opportunity to address that part. I mean, everyone's talking about the underlying medical conditions. The numbers are quite high, right? But I think that frontline essential workers is also very important for people to know about. And so can you just talk a little bit about that, even though I know there aren't really answers to some of it yet, but if you could just address it and tell us that situation.
I mean, I think frontline essential workers are the basis of our community existence, right? We have so many people that that's what they do for their work. They're frontline. They are service-oriented individuals. They're teachers. They're people in libraries. They're grocery store workers. They are, the front desk people, greeting people for medical appointments. They, these frontline essential workers, they are essential. They are what keeps our business and lives going every day. And, I'm anxiously awaiting for, teachers to be able to be vaccinated because, we want all of our kids in school, right? And in order for schools to be open, teachers have to be healthy. So, if you ask me, I wish we had enough vaccine for everybody tomorrow, So, It's a long list of this 1B has a very long list of
Right.
of criteria that
Do you anticipate, or do you know if that will open up at the same time, that registration will open up at the same time as underlying medical conditions? I know it's the same phase. Do you have any reason to think they might split that, or because that's going to be a lot of people? And also the big question, of course, when do you think they'll determine who actually qualifies as a frontline essential worker for the purpose of the vaccine?
you know what, I'm really, that's a really hard question for me to understand. Oh, that's not the one I'm looking for. There is a big long list, and I'm not on the allocation committee, and I think that allocation committee at the state, which Dr. Sullivan is a member of, does represent a nice diverse sector of the Connecticut community. I think sometimes when I have discussions with Dr. Sullivan, it seems like they have a really difficult time trying to determine, and really discuss and really, identify who is the next priority group. I think it's really challenging.
Oh, yeah. And I know you don't know the answer. I just wanted to put it out there so people understand there are a lot of people. I know the population data in Brookfield or the greater Danbury area, but just multiply some of those numbers, 40% obesity rate. In some cities in Connecticut, the obesity rate is up around 60%. So if 60% of the adult population, meets a criteria as an underlying medical condition because of obesity, that's a lot of people to vaccinate. Sure.
A lot of people, and everybody, and look at how many teachers are in our workforce and in our schools. There's 152 towns in Connecticut. We all have school districts. We all have teachers. They're working with our children day in and day out. There's so many important eligibility groups.
Sure. I think maybe to wrap up this part of the discussion, I would ask you if you could let us know where should people look to find the latest news about when the different phases are open, anything more specific about the phases and who's included, any changes, any announcements, where do you want people to go? Where will they hear it first?
Okay, so you want to talk about that, Ken?
No, I was just going to say, I looked at it today, portal.ct.gov. It's all right there. And then there's layers of it. But they have, 1A, 1B up, and then they have second phase of 1B, frontline workers and people with chronic conditions. And then they have a drop down for who that's going to be. And then they said the second phase is coming sometime in March, but there's no date on it yet.
Can you see my screen right now that I'm sharing that says
There
Connecticut COVID-19 response?
Yes.
Yeah.
So there's the portal right there.
Yeah.
Connecticut COVID-19 response. Now, one of the things that we're trying to do at the town of Brookfield is put out updated information on the Code Red Alert. So you could sign up for the town's Code Red Alert, because as soon as we hear it, we try to get it on the Code Red Alert. So we're trying to communicate as fast as we can out to people in town. So that's something, and actually that's really important to our first selectman, Steve Dunn. He wants that Code Red updated every Friday. So it is one way to hear about information. You can check this site yourself. There's all the eligibility groups right here.
Yep, so here's remaining 1B coming up right there. Yep. And then if you hit this link, CDC, that'll give you all the conditions of high risk and possible risk.
This one here. Yep.
Yeah, there it is. Yeah.
And do you think that the Connecticut
See, there it is. Yeah. Mm-hmm.
Do you think Connecticut will follow this? I mean, you believe that this is what they will use to determine, or we don't know? But
Well, this is on their site, so I think they are. Yeah.
Okay. Fair enough.
Yeah. No, I think they're going to. This is it. Yeah.
Okay. Great.
Yeah.
Okay, and they can watch they can, if anything is updated at the state level, it'll be reflected on the Brookfield Health Department website and the town website and everything.
We're trying to keep our frequently asked questions up to date. So we're trying to do that. We're also, like I said, the Code Red Alert. You can go to our website and, all of our announcements are listed really on the very first page now. So you'll see them. Dan Secor, who's working in our IT, he's so busy trying to keep up with all of those communications. He's doing a really great job. And because he's getting information from everybody, but he's able to kind of really put the COVID-19 response. He's done a really great job, and I really enjoy working with him on getting that information up to date.
That's great. Okay, so I think that we covered that issue as much as we can. There's only so much information we have. So there were a couple of questions that people had that they sent in that sort of were about reaching out to people who are harder to find. And I know you touched on it and the Ask a Neighbor, Help a Neighbor. And we talked about this in our first meeting too, but there are a couple of specific things that I wanted to just ask you. And one is someone wanted to know how homebound people are getting the vaccine. Are they currently getting it administered in Brookfield, or are they still having to wait to determine how that's going to be done?
So we're working on a plan now. We're identifying who they are, and Dr. Sullivan and probably one of our nurses would like to go. If they want the vaccine, he's willing to go to their home and administer the vaccine. So we're trying to put a list together now of who those homebound residents are. And I'm working with the senior center director. I have a number of volunteers who help me make phone calls. And we're really trying to identify who are some of those who are living at home that really would have a hard time getting to the senior center. You'd be surprised though, like we've had a number of older adults be driven to the senior center by their children. And the nurses have gone out to the car to administer the vaccine.
Oh, that's
so,
nice.
we do what we have to do to make it work, and, we understand that there's a lot of mobility issues. The Brookfield Senior Center has been a really great location to hold our vaccine clinics right now. Because right now our clinics are still on the smaller side because of the number of doses that we have. But I am working with the planning team to eventually expand our location. We're working on a plan at St. Joseph's School, which is right now empty, to be able to deliver vaccines out of there once we have more doses of vaccine.
Wonderful. And then someone had asked, and I think we did cover it a little, but I'll just ask it again, just so you have the opportunity to say it again. And that's how are you reaching people over 75 who haven't received the vaccine? And is that being tracked in any way?
We have a number of volunteers helping us do that outreach. We do have to, I do have to ask the neighbor to neighbor, because, if you live in a neighborhood and you know somebody, you might know them better than we do. And getting them in contact with us in some way would be really important. But like I said, I have volunteers calling lists of people all the time, trying to do that outreach, and we are reaching out through the churches as well. I know many of the churches are making announcements and asking people to get in touch with us if they are homebound or elderly and can't figure out how to get a vaccine.
Great. Okay, so now let's turn to after the vaccine. And again, we'll circle back at the end and talk about some of the more specifics about the vaccines and supply and Johnson & Johnson and a lot of things, but just to sort of follow this track for now and deal with some of the questions from the public. People really want to know how long after they get their vaccine before they can get back to some semblance of regular life. Mm-hmm. So how long after the second dose can they assume, or can we assume they have enough antibodies to socialize, to not wear a mask, so any of those kind of things?
Yeah, I mean, that's a hard question, but the take-home message, people are still going to have to be careful until we have herd immunity in this country, till we have really 200 to 250 million people vaccinated. So right now, when someone completes their series, and it depends on the vaccine, the antibodies actually develop a little bit differently. Like the Moderna vaccine has a higher antibody response after the first dose than the Pfizer. It's like 80% after the first dose. The Pfizer's like 50%, but they both reach about 95% about 4 weeks after the second dose. So at that point of a good month, the antibodies kick in within 2 weeks after the second dose, but you reach that full antibody at about 4 to 6 weeks after your second dose. But at that point, you're really not home free. Now, it depends on the vaccine. The Moderna and Pfizer vaccines are 95% effective, meaning that 95% of the people basically do not get any illness at all. The people who do get illness get very mild illness. They're remarkably safe. We'll talk about that after, but there's still a 5% chance you can get COVID. If you have one of those two vaccines, unequivocally, with one exception, there was only one patient in the Pfizer trial of 44,000 patients who was vaccinated who got severe illness. In the Moderna 30,000 patient trial, phase 3, not a single patient who was vaccinated got serious illness. Serious, it's amazing. They're amazingly effective, but still 5% can get COVID. And these vaccines are preventing not only illness, but they're preventing transmission. So if you're in that 5%, you could transmit the disease. So until the world around us is safer, if you're one of the lucky people to get vaccinated early, like some of us, you still have to be careful. You still have to wear your mask when you go to the supermarket, et cetera. For now, until the burden of infection and the burden of transmissibility is better, which is going to be many, many months from now. And also until we know a lot more about the variants, because some of the variants, we could talk about that after, but some of these vaccines are looking better against the variants than some of the other ones. In particular, the mRNA vaccines, the Moderna and Pfizer vaccines are very good against the variants right now, particularly the Pfizer vaccine. So you still have to be careful. You still have to social distance for now. You still have to wear your mask.
So someone asked a more specific variation on this question, which
I saw it.
which is if you have both vaccines, both doses, excuse me, and can you socialize with other people who have had both doses? And let's even say 4 weeks have passed. So can you?
So you're asking about a soiree with a cocoon of people, maybe 3 couples, 6 people who are all vaccinated, and they're 6 weeks after. Well, clearly, and if they know each other and nobody is ill, they're probably fine, but there's still a 5% chance with each one of those that they could be carrying a variant or a mild case of COVID. But each of the others being vaccinated has a very strong chance that they're not going to, catch it. So I think if I were in that cocoon, I would still want to socially distance quite a bit, and even wear a mask or try to be outside if you could. I mean, right now you can't, but pretty soon we're going to be in the spring. I think you really still have to be careful until we really know a lot more about the variants. So yes, you're statistically you're safe, much safer if you're with one couple that's vaccinated, or at most maybe 2. But I still think you got to distance yourself and be smart.
Okay. And I mean, essentially, that's probably until there's herd immunity, and then the virus, just the prevalence of the virus is lower because of that, and that's why it's safer then.
Yeah. Once we reach probably, 70% vaccination penetrance, 70% of the population is vaccinated, which is like 210 million people. The population is 330 million in the United States. I don't know how many children we have, but we probably have, maybe 50, 60, 70 million children, young children I'm talking about, because adolescents will eventually get vaccinated also. They're a big problem with transmission in this country because they have a high rate of asymptomatic transmission. But so, we're talking about at least having 210 to 240 million people vaccinated before we have herd immunity. So it's going to take a while. It's going to take till the summer, if we're lucky. And as long as the Johnson & Johnson vaccine is approved, which looks like a great vaccine, it's not quite, the effectiveness rate is about 85% in preventing serious infection, whereas the mRNA vaccines, the Moderna and the Pfizer, are 95% effective. So, but the nice thing about the J&J vaccine is after 2 weeks and it's a single dose vaccine, after 2 weeks, you have high antibody levels. And true, it's only 85% effective for serious illness. It's 66% effective overall. So it is a little bit less efficacious, but it requires simple refrigeration, 1 dose, and it has high antibody levels after 2 weeks. So I think it's going to be a great vaccine and a big help.
Wonderful. I actually have a few questions about that. There's just one other thing I wanted to touch on quickly before we get to the Johnson & Johnson and other questions related to that. And again, it might be something that you don't have the specific answer to, but at least we can sort of throw it out there and just see what the issues around it are. And that's about supply. And so, of course, that's in the news all the time, and mostly because there are issues with supply, right? And so basically, I know you can't answer too much about that because a lot of it's out of our hands, right? But can you just tell us what the process is for getting the vaccine in Brookfield or any town? I mean, it comes from the manufacturer to the federal government, to the states, to the towns, essentially. Or can you just talk a little about the process and when how many doses you're going to get? I mean, this might be a Maureen question. Do you know the day before?
That's my question every week. So, yeah. So obviously the vaccine is distributed at the federal level to the states, and the states get their allocation. And from the state allocation, I think there's 152 towns in Connecticut, and so there's health districts, and so they have to determine the distribution of the vaccine to all the different towns in Connecticut. So every week we have to let them know how many doses we want, but we're also asked not to make too many appointments in case we don't get the doses we asked for. So it's very challenging. I will say that with this new group, the 65 and over, we're just all starting to get notified that we're going to have a more vaccine. Is it a lot of vaccine? Still not a lot of vaccine, but more than what we had. And then it's, we have to create a plan for getting that administered and into the arms of everybody that we can administer it to. And can I just tell you that we have a great team of vaccine administrators, people who are working tirelessly every week to get the vaccines that we do get in Brookfield into the arms of residents. And it's unbelievable the number of high quality doctors, nurses, front desk, individuals, people with business backgrounds, people that are willing to help solve this problem. I feel so fortunate as being able to be a part of this team. And I feel, very optimistic that we're going to be able to build capacity in town to deliver more vaccines. And once we get all that built, we will be a really well-oiled machine delivering these vaccines. And it's because of the people that are so committed to making this happen. And Ken is one of them. He's one of my he's a great partner to be working with. And obviously I know Ken for a very long time. He's one of the ones who brought my husband and I into town. So I know Ken a long time.
Thank you. But Rachel, we should have a good supply, in the next few months. Pfizer's committed 200 million doses. Moderna's committed 200 million doses. So that's 100 million people each, right? 2 doses. J&J, which hopefully will be approved in a few weeks, has committed 100 million doses. That's a single dose. So there we have 300 million doses. And then there's a fourth vaccine, Novavax, which is a little bit different technology. It's actually a technology where they've incorporated the actual spike protein of the coronavirus, a copy of that, into it's like a protein subunit in the vaccine, and they have pledged 100 million doses. And this is just within the country.
Okay, that was my question. Is it for U.S. distribution?
Yeah, Pfizer and Moderna are going to export. I mean, Moderna said they could make 1 billion doses this calendar year. 1 billion. That's amazing. So they're going to be helping Europe and the rest of the world. And Pfizer is too. Pfizer is vaccinating Israel. Half the country's vaccinated, and Pfizer has pledged a lot to the EU also. So we're helping the world, but we're going to be covered as long as, you know, these next 2 vaccines get approved. And I think Johnson, go ahead.
Oh, I'm sorry. And those numbers that you said about the number of doses, that's by the end of the year, or did
Yeah. Oh yeah, that's this calendar year. Yeah.
Right.
Yeah.
Amazing. So ordinarily I would have started the whole conversation with this because I think logically it makes more sense to talk about the vaccines and the science of it, but I just really wanted to get right to the meat of what people probably really wanted to hear, which is when are underlying medical conditions going to be a valid reason to get the vaccine? So can we talk a little bit about the vaccines? What I'd like to, if you would, if you can just sort of explain in broad strokes what an mRNA vaccine is.
Okay, yeah. There's like 5 separate technologies, but the vaccines we're talking about are basically 3. So the 2 newest vaccines is this mRNA. It stands for messenger RNA, and it's basically a copy of one side of the genetic code, DNA. And the mRNA codes for proteins. And the thing that makes the coronavirus so difficult and viral and dangerous is that it has this spike protein that allows it to attach to cells and rapidly get in cells. So those 2 vaccines, Moderna and Pfizer, incorporate a genetically made messenger RNA, an actual code for the spike protein. It's in a lipid molecule, a fat molecule, and it's in the vaccine. And when it gets into our body, it's taken up by our cells, and they incorporate this into their DNA, and our immunological cells actually start making the protein and develop, and then from that we make antibodies. So the J&J uses a different technique. That and the AstraZeneca actually use a weakened cold virus called an adenovirus. And what they do is they actually put not the mRNA or RNA, they put actually the DNA for the actual DNA that codes for the spike protein into the cold virus. And the cold virus, by the way, is weakened, attenuated. It can't replicate and it can't cause disease. It's just a vehicle, transport. So the cells take up the cold virus, adenovirus, with the DNA in it, and then they take the DNA and they make the protein, the spike protein, and then it comes out of the cells and we make the antibodies. So it's very, 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 ingenious.
So is that not using the technology that the technology that other vaccines have used in the past? Is that also a new technology, a new way of making?
No, it's not. No, you're right. Like the mRNA, even though it's a new technology, it's been developed for about the last 10 years. And I was going to talk about that when we talked about safety. But the J&J vaccine and the AstraZeneca, using these attenuated cold viruses, this has been done for decades. It's proven. And then the Novavax also, taking like proteins and putting them in there, that's been proven technology too. So those vaccines are old type technology that are being applied to and used with the coronavirus outbreak.
Now, let me ask you, with the Johnson & Johnson, and we'll talk about this a little more specifically later, but I'm just curious, are the efficacy numbers on these vaccines better than other viruses that the same technology has been used for in the past, or is it about the same? Do you know what I mean? Like,
well, I mean, if you compare it to flu virus, it's not as good.
Is that due to the nature of the flu virus, or is it due to the nature of the vaccine? It's probably due to.
I think that's due to the fact that there's a lot of mutation with flu virus, and it's such a moving target and changes so much. It's very hard to actually get it really close to what the current flu virus is. But the J&J technology is old and it's been proven, and it's very, very effective. The Moderna Pfizer is a newer technology. Actually, these two vaccines are the first two vaccines on the market with this mRNA technology. Now, both of these companies have been working for 10 years. Okay, Moderna has been in business 10 years. They only do mRNA vaccines, and this is their first product. Pfizer is just a powerhouse in terms of vaccine development and has a long history of vaccine development. And they actually have funded the research completely on their own. Pfizer spent $2 billion of their own research money developing this vaccine. And they did it in conjunction with their partner, BioNTech in Germany. And it's amazing that they using this technology came up with a vaccine that's so similar, almost identical to what Moderna did.
So let's talk a little bit about the mRNA and safety. So I think sort of a couple of things here. One, I know the technology is a decade old or whatever, but there are a number of people who feel that, it seems to be jumping the gun a lot to use this on such a massive scale when even though it's been studied, it hasn't been used to this degree. So do you have any concerns about that? Should people have legitimate concerns about that?
It's a legitimate concern because it is a new technology, and these two vaccines are the first two vaccines using mRNA technology. One of them by a newer company that is bringing its first product to market. The second one, a powerhouse with a long history of vaccine development. I looked at the studies closely. So the phase 3 studies is the final study that a company does that allows the product or the vaccine to come to market and to go to the FDA for approval. Pfizer had 44,000 patients in that phase 3 study. Moderna had 30,000 patients. The worst side effects we saw in all those patients with both the companies were just headache and fatigue. There were literally no serious side effects, certainly no deaths. No one got seriously ill. There were no serious side effects during the phase 3 trials. Now, that doesn't mean that going forward, as we give it to millions and millions of people worldwide, there's not going to be some worsening side effects, because the vaccine will encounter people of variability makeup, different physiological makeup, et cetera, different allergies. So it is possible. It's being monitored. But so far they look really, really safe, And
actually they're collecting information on that.
Oh yeah, ongoing. Yeah.
Yes, and one of the things that you're asked to register for after you've gotten your vaccine for the first time is a online text message called vSafe, and it's asking you what are your symptoms, and it'll ask you at every day, and then it'll go every week, and then it wants to know, is your arm sore? Do you have a headache? It wants to know what kind of symptoms have you had. I think it's really important actually for people to participate in that, because that's going to give a lot of information about the vaccine down the road. It's like an ongoing study in itself.
Right.
And it's voluntary. You don't have to do it, but it's a great tool.
The vaccines also, Rachel, so far they look very safe, but the monitoring is ongoing. And that's why it is an emergency use authorization. They are not fully authorized. They are continuing to be monitored, and, there could be changes in how they're used. But so far they look very, very, very safe. Now, anecdotal evidence, I've known a lot of people who've gotten their second dose, and they get a little bit sick with headaches, muscle aches, fatigue. Like me, my better half is kind of achy and headachy and tired because she had her second dose Moderna vaccine today. And she slept for a few hours and had to take a Tylenol. Well, big deal. These vaccines are very, very effective. And the next question that was on our agenda, should we take this vaccine with only an emergency use authorization? they're working. These vaccines are working incredibly. Israel has vaccinated half their population, and they have a 90% decrease in transmission as well as disease. The University of California Health System, I have a very close family relative who's the physician out there, and they have just reported in the last few weeks, after 90% vaccination of their employees, they have a over 90% decrease in cases and transmissibility among their employees. So these vaccines are incredibly effective. And
but I think what people have as a stumbling block is the emergency use authorization.
yes,
Feels like it should be something that's only used in a dire emergency until, and that may not
Rachel,
be really what it means, but that I think
you don't
have a hard
think
time getting their head around that.
if you don't think this coronavirus pandemic is not a dire emergency, then nothing is. I mean, more people have died from this than died on the battlefield of World War II. More Americans have died than died on the battlefields of World War II, which was 425,000 people. We're past that already with this. So this is an emergency.
Sure. Yes, I'm only speaking for what I think other people think.
Yeah, you know, I have a neighbor whose husband's a research scientist, and she's very reticent, and she likes J&J, and we were talking, and she's going to wait for the J&J vaccine. That's fine. It's an older technology. It looks like a great vaccine. It looks safe. It's 85% effective, easy to take. Take it. I think it's going to be a great vaccine. I think it's a great vaccine for our teachers, actually, the J&J, because it's easy to, yeah. High antibodies after 2 weeks, 1 dose, get back to work.
Absolutely. No, I totally agree.
Yeah.
So when can we expect a full FDA approval of the current vaccines, of the mRNA vaccines? Is it just a matter of they have to have a certain amount of time pass before they can get the full one? Or is it, I mean, what's the
I mean, I don't know their exact protocol, but it's going to be a while. I think they're going to really analyze, hundreds of thousands of people, before they give full approval.
Okay. Do you think that it's conceivable that we would achieve herd immunity and people would all, enough people would be vaccinated already before there's full approval?
Yeah. Oh, yeah, it's possible. Yeah, they may hold it off. I have no idea really on that question, but it may be 6 months before they give full approval, or it may be sooner. Yeah.
And then the current the 2 mRNA vaccines, what is the current science on how they how they deal with the variants, the ones that we know about? Like
yeah, that's a really good question. Right now, I mean, they're looking at that. That's a really good question. Right now, the Pfizer vaccine looks a little bit stronger against the South African variant. Both the Moderna and the Pfizer are very, very good against the UK variant. Very good. The Pfizer's a little bit stronger, a little more efficacious against the South African variant. The Johnson & Johnson is only about 50% effective against the South African variant, but it's strongly effective against the UK variant. The great thing about the mRNA technology is it's easily scalable and can be differentiated and changed. Moderna is already looking at altering the mRNA technology to produce that strand that codes for the protein. They can change that quickly in the lab. So when they see remember now, the genetic codes of these variants are just slightly different. This virus, matter of fact, the genetic code of the virus that came from China and went to the West Coast in America is slightly different than the exact genetic code of the virus that came to us on the East Coast from Europe. They can tell by looking at it where it originated. So they can alter, Moderna and Pfizer can alter the mRNA a little bit to cover and to be exactly like that South African variant or UK variant, and they can work that into a booster shot. Moderna is already researching a booster shot to incorporate some of these variants.
Would the booster shot be like a full year later? Do you happen to know how, if you've got both doses and then there's a new variant?
They don't. Yeah, I would say a year. It's going to be a year. I expect a booster shot in a year. Okay. I would guess that. Yeah, yeah.
And just as a side question, which we hadn't talked about before, but how much is the United States now doing in terms of doing the genetic, looking at the genetic components of the genetic makeup of the variants to track that? I know that it wasn't being done, and there's a ramp up.
Yeah, they're doing it actively. They're doing that all over. Yeah, they're actively looking at that. Yeah,
because it wasn't widely done.
We have a case. I don't know if there's the first case of the. I don't know if it was the South. I think it's the South African.
South Africa, yes.
Yeah, it's in Fairfield. It's right here in Connecticut. We have one case, and it's in Fairfield.
But do you think that it's likely that there are more? I mean, well, whatever. That's hypothetical. You can't answer that. It hasn't been being. They haven't been being screened that closely, though. Well, right? It's not like every.
I mean, isn't the whole idea of a virus is that it's any virus can change?
Yeah.
Right? Isn't that any virus? The flu virus changes.
Right. And see, the more the virus transmits, the more it mutates. That's why it's so critical that we ramp up vaccination and vaccinate rapidly, as quick as we can, because once we break transmission, we are also going to be breaking mutability, the ability for the virus to mutate. Yeah.
And I know we've talked about Johnson & Johnson a little, and you talked about the technology used in that, and that is an older technology. So can you explain, people will see that the efficacy of the Moderna or Pfizer vaccine is in the 90 percentile.
95, yeah.
And Johnson & Johnson is 65. So,
well, it's 66 actually overall, prevents disease overall, but it prevents severe disease 85% of the time. Whereas the Moderna is 94.1 and the Pfizer 95 severe disease. So it's extremely unusual to have such an effective vaccine as Moderna and Pfizer. The Johnson & Johnson 85% reduction of severe disease is pretty darn good.
I just want to bring it up because I think a lot of people will hear that one is in the 90s and one is in the 60s, and while I want the 90s, I'm going to wait for that. So I just wanted to get it out there. I mean, it is very effective against severe disease. It may be a great choice for people who are generally healthy, right? And that.
Yeah, I think so. I agree. I agree. Yeah, that's a really good way of looking at it. Yeah.
But people who have the underlying conditions and other or who are older, would you recommend as a physician that they would try to get the Pfizer or Moderna?
Yeah, I think if they had a high risk patient and they had the ability to choose Moderna versus J&J, I would say try to get the Moderna.
Okay.
But you're right. I think if somebody's otherwise healthy, I think the J&J vaccine is fine. Yeah. I think it's going to be a great vaccine.
And then the AstraZeneca, we haven't talked about it quite as much, but is that?
That's very similar to the J&J. Yeah, it hasn't been submitted here for approval, so I don't know if they're, it's Oxford and AstraZeneca is a British company. I don't know if they're going to submit it to us for approval. There's about 17 to 20 different vaccines around the world. China has a bunch, Russia. So a lot of them around there. Some of them will just never reach our FDA.
Okay. But so basically right now, those are the Pfizer and Moderna that we all know. And then the Johnson & Johnson is being reviewed now for emergency use authorization. And is there anything else that's currently with the FDA for emergency use authorization that?
No, but the Novavax is probably going to come up shortly in the next few months. The Novavax, they expect to in the next month or two. They started their phase 3 trial in December. It's being done in the United States and Mexico, and they hope to have that completed probably in a month or two. So that'll probably be submitted this spring.
Okay.
It'll come in later in the year. And it looks 89% effective in preliminary trials. So it's almost 90% effective.
And that's an attenuated adenovirus also?
No, that's actually taking the actual protein spike, the actual protein antigen, and incorporating that right into the vaccine. So you're giving the protein that you want to make the antibodies to. So, and then the protein's there, and you start making antibodies, and you're off and running. Yeah.
And is that a single dose also?
It's 2 doses. I'm looking at 2 doses 4 weeks apart.
2 doses 4 weeks.
2 doses 4 weeks apart. Yeah.
is it a cold, do you know if is it a cold storage situation?
No, it's it's just like the J&J vaccine. It's just simple refrigeration. So it's Novavax, and they can do 100 million doses this year, as well as the J&J. Simple refrigeration, long shelf life with simple refrigeration. Could conceivably be in doctors' offices.
Right, or a CVS or whatever, right?
Oh, absolutely. Absolutely. Yeah.
Okay. So we talked about side effects a little. I think that we don't need to cover that again. And so, and I know we did talk about this a little bit, but I just want to bring it up again, like what efficacy means, and that people can still get sick, and so
Right.
what's the, is there anything you want to say about that so that people understand what getting vaccinated really means in terms of your risk of disease?
Right. I mean, efficacy is really a statistical number that you apply to the vaccine and to you as an individual. Say that if a vaccine is 95% effective in preventing severe illness, that means 19 out of 20 patients who get it are going to be protected. But there's going to be 1 out of 20, right? 5%, 1 out of 20, who basically could still get the disease. But from what we've seen with the Moderna Pfizer, that person who's unlucky to still get sick will not be seriously ill. He or she will not have serious illness.
Now that is important to know, that they even may be asymptomatic, right? I mean, that's sort of one of the reasons why, even if you're vaccinated, you need to keep wearing a mask, because in theory you can still get it and you can transmit it to someone who's
You're in that 5% who has mild symptoms, right? If you're in that
Exactly.
5% that gets mild symptoms of the virus, still transmit it.
Yeah, you could transmit it to somebody who's not vaccinated.
Yeah.
Your little soiree group there may be okay at night, but if you go to the supermarket, you could still transmit it, or. Yeah.
So I think that's a big thing for people to, that's on people's minds, that don't understand why they have to keep wearing a mask after. And I think, that's one of the. Yeah,
people are tired and frustrated wearing masks. It's not easy, right? But, when I go for hikes, I wear a mask, and if no one's around, I'm just with my wife, we take a note. If we're in the middle of the woods in Washington or Roxbury, Connecticut, we put our masks up if we're passing somebody, even though we're outside, just to be careful. We're just going to have to keep being careful for a while longer. We have to just, be tough a little bit longer.
And then I'll ask the crystal ball question, which is, when is this all over? When do we have a huge bonfire and burn our masks? When can we do that? When can we hug a stranger?
I heard Dr. Fauci was asked that question last night on the news, and he said, and I don't know that he said no masks, but he said that life might feel more like normal about next Christmas.
Yeah, I think he's right. At the end of the year. Yeah, I think he's right. At the end of the year. Yeah.
Okay. Well, I guess we'll just hold on. I mean, they don't really have an alternative.
we're all feeling it. We're all feeling it, and that's why I feel so committed to making sure that this vaccine program is successful in our communities, because I think it's so important for all of us to get our lives back and to have all of those things that we love to do, and not feel like we have to be masked, or we can hug our grandkids without worrying about it, or our mom or dad. It's important to everybody. And our focus right now at the health department is really to ramp up the vaccine program, and that's where we really need to be focusing our time. And that's going to be an important challenge for us, but I think we have the team that can do it.
Well, I'll tell you, Brookfield's really lucky to have both of you and the whole team that you're working with. So thank you so much for.
Maureen has a great group of nurses. She's recruited an incredible, strong group of experienced nurses, not nurse students like are vaccinating at the hospitals, because that's who's vaccinating, at the local hospitals are senior nursing students. And they're good. They're fine.
They're doing a great job.
But we have experienced nurses, a lot of experienced nurses. Yeah.
And doctors.
And doctors, yeah.
Is there anything else that either of you would like to say in closing, or do you think we've covered what we need to cover? Or?
I'm going to say one last thing with snowstorms.
Sure.
So if you get a vaccine appointment and there's threat of a snowstorm, please know that your vaccine clinic is supposed to be responsible for letting you know how you're going to get your vaccine. And so, for example, we did send out a communication. We put it on our website. We said it in code red. We sent an email to everybody who had an appointment for us, either Thursday or Friday because of the storm. I felt it was important to make sure that people were safe, right? I didn't want seniors walking on slippery ground or driving in snow. So we rescheduled all of our appointments are just like all the Thursday appointments are Saturday. So whatever time you were supposed to go on Thursday, you go that time on Saturday. Whatever time you were supposed to go on Friday, you go that time on Monday. But it's the clinic's responsibility. They will tell you. My best suggestion is watch your email. If there's a storm, look at your email. You will get a message. We're asked at this, at the state level, if you're getting vaccine and you have a snowstorm and you cancel your clinic, you need to figure out a way how you're going to get those people vaccinated. Okay. So it's not, you need to just watch your email because that's probably the easiest way that they'll communicate with you. And there may be a phone call or look at announcements. Look at, like, if it's in Brookfield, look at the website for announcements. It will be announced, So yeah, we took a lot of phone calls about the snow, and really we ended up communicating about the snow Wednesday afternoon, that our plans were, but we had calls Monday, Tuesday, Wednesday, Thursday, but we actually sent out our communications on Wednesday. So watch your emails.
Okay, thank you.
Mm-hmm.
And Dr. Pellegrino, do you have anything any parting words that you'd like to share?
The vaccines are safe and effective. And we're actually really lucky here in the United States to have really 4 vaccine candidates, 2 already on the market and 2 coming up, that all are very effective. So we're really lucky. This is the way out. Vaccination is the way out of this pandemic. It really is.
Well, thank you both so much for taking the time to speak with us tonight. And
our pleasure.
Really,
thank you, Rachel. We really appreciate your time as well.
Thank you. My pleasure. Okay. And the program will be on the YouTube, a recorded version will be available on YouTube so people can watch at a later date. And if there's any other news that comes up, maybe we'll meet again and have
Great. Thank you.
Great. Thank you.
Thank you.